We're focused on your posture, how you stand in relation to the table, and the importance on keeping the upper limb relaxed and at the functional angle, a bit like a puppet. The next important thing that determines how well the needle rotates through the tissue is the pickup of the needle itself. Now, not infrequently, the needle is passed to you, mounted back from the tip and at 90 degrees to the end of the needle holder. This presents a problem. And the reason it does present a problem is because of this. As surgeons, we're often operating down within the body cavity, and the wrist drops below the elbow, and the tip of the instrument is below the wrist and below the elbow. Notice what happens when I bounce the needle on the table. When the needle is mounted at 90 degrees, you lose the sagittal plane of the needle to the tissue, and the tip of the needle is bouncing and making a noise on the table. The angle that the needle needs to be angled out to get the perfect rotation and the perfect sagittal plane of the needle is the same angle at the tip of the instrument as is the angle between the wrist and the elbow. Notice the wrist is below the elbow. The angle there between the forearm and my hand is exactly the same as the angle between the tip of the needle holder and the needle. The needle is now aligned to rotate through the tissues. The only occasions where this needle will change is if the tissue is in the same plane as your wrist and your elbow, and therefore the tissue you're stitching is at the same level as your wrist and elbow, and then you can rotate it to 90 degrees. But I've always thought it strange that all the wet lab courses, as I've seen run, people are sitting down at tables, the tissue is on top of the table, and they're practicing stitching. Wrong. The only surgeons that are sitting down are usually urogenital surgeons or ophthalmic surgeons or maybe neurosurgeons, but even then they're not sitting on static stools. They're sitting on stools that are on wheels that go up and down. Most surgeons are standing, and that's why it's important when we're learning to stitch and to practice, we stand. It is also important that we put what we're going to stitch inside the box or inside the body, and to simulate that, put it inside a pudding basin. When you do that, you'll realize the tip of your instruments is below the angle of your elbow, and therefore you have to rotate the needle out to get the angle. The angle of rotation for the forearm for big needles and rider needle holders is between the head of the radius and between the middle and index fingers. That's the perfect pronation and supination of the forearm. And you can note that that pronation supination of my forearm maintains full rotation, full angles, no matter what angle my shoulder is and what angle my elbow is. Now you know that because you've put a flat cap cupboard together or fixed a car and had to get a screwdriver into all sorts of unusual angles. Much the same with stitching. Note how my elbow and shoulder changed to enable me to move. Not infrequently, I see surgeons putting their fingers through the rings of the needle holder. I can understand why, because a lot of people find it difficult to unlock and lock a needle holder using the thenar eminence. I put it to you that you should practice this benediction sign and practice with a needle holder loading and unloading your needle to enable you to get the proper pronation and supination of the forearm. If you do have to put your fingers through, please do not put your distal interphalangeal joint through the instrument, like that. Your lose the touch and you lose the sensation and the feel of the instrument sitting in the palp of your fingers. So before you even stitch, when you get past a needle, by a scrub nurse, take a look at it. Is it mounted correctly? Is it actually at the tip of the needle holder? And is it angled out to compensate for the instrument working at a level below your elbow? This applies to a big instrument as well as a Castro's. Even more importantly, with fine instruments and fine stitching, is to ensure that your rotation is clean. The setup and the position of the needle is exactly the same to compensate for the fact you're working down in the chest. To ensure that you've got the pickup correctly, a clever way of doing it is place the needle on the palp of your finger and bring the instrument into that at an angle, making sure that you can feel the shaft of the needle and the tip of the needle holder at the same time, and therefore you won't have that space between the two. And bringing it in at the angle enables you to maintain that sagittal plane when you take it down into the chest. The important thing with Castro's is this all finger movement. Once you've aligned the needle, and previously I described the alignment is at 90 degrees to what you're going to stitch and 90 degrees into what you're going to stitch. And to effect that, it's important to have a backswing and rotate the needle. Note the rotation holding a Castro's is with the fingers alone. There's no wrist movement, there's no movement of the elbow, there's no dropping of the elbow. Now, there's one other important thing when instrument handling. I'm using a locked Castro's. Some people train and use Castro's without a locking mechanism, and I understand why. The reason is that many people, when bringing a fine needle to a coronary vessel to stitch, keep it locked until the moment they're wanting to actually rotate the needle through the tissue. What happens is that at that stage they involuntarily unlock the needle and in doing so drop the wrist and forearm, bringing unnecessary movement and potential damage to your coronary vessels. In that regard, to avoid doing that, you need to ensure that you unlock the needle before you start your backswing and rotation, to ensure that you're not dropping your forearm and you're not bringing extraneous movement into the rotation. The principle of rotation is to relax the needle through. Backswing, rotate and relax it through. That applies to small and big needles alike. 90 degrees into what you're going to stitch, clean rotation through, pick it up and deliver the needle. Now, we're going to do this practice with a non-dominant hand behind our back to maintain our lumbar lordosis and posture. You will ask, well, what is the left hand or non-dominant hand doing in the process? For the purposes of stitching, I put it to you very little, because the needle is actually held by the tissue. Once you have set your needle up properly at the right angles, 90 degrees to what you're going to stitch, 90 degrees across what you want to stitch, then you have lined your upper body and your forearm to effect that rotation. All you need to do is rotate. You'll then find that the needle is actually sitting in the tissue, ready for you to pick up and deliver progressively to use again. And you should be set up for the next stitch. It works with big needles and it works with small needles. Now, the only time that you're bringing a Castro's in or a needle holder in to support the needle is if there's insufficient tissue to actually stabilize your needle in the tissue. Your forceps can be held used to stabilize the needle to enable it to be picked up. We're going to show you how you can practice this in our DIY demonstration using a baked potato. That is for big needles, a banana with 5/0 needles for top ends, and a poached egg for 7/0 needles and bottom ends. I guarantee it works. The important thing is these exercises are going to teach you lightness of touch, and they're going to reinforce the principles of rotation and relaxing the needle through the tissue. Just imagine a diver taking a dive into a pool. He's judged on how well he enters the water. The best dive is entering the water without any splash. The great thing about the potato, poached egg and the banana is if you don't enter those materials accurately and precisely at 90 degrees, you'll see that splash immediately, and you know that you've been rough and haven't relaxed the needle through the tissue. Respect, that's what it is. But it's understanding your body position, understanding how the needle is made, understanding the pickup. And I can see trainees struggling right from the beginning because they've failed to identify that angle. It's very easy. 1, 2, 3. Is the needle mounted in the correct position along the shaft? And we'll come back to that later on. Is it angled out properly? And have we ensured that it's at the very tip? Only by doing this can we ensure that you get perfect control and rotation through the tissue.